Good afternoon, and welcome to the National Cancer Institute's latest Facebook Live. We are broadcasting today from the Children's Inn on the NIH campus. Today we'll be talking about the psychosocial aspects of childhood cancer treatment. My name is Dr. Lori Weiner, and I direct the Psychosocial Support and Research Program at the National Cancer Institute.
I'm Dr. John Glad. I'm the Clinical Director of the Pediatric Oncology Branch at the NCI.
I'm Stephanie Feinberg. I'm a Resident Services Manager at the Children's Inn at NIH. We are a nonprofit organization located directly across from the NIH Clinical Center that provides housing and services to children and young adults going through treatment at the NIH.
In addition to the three of us, we will also be joined toward the end of this event by a parent who has a patient at the Children's Inn.
In conjunction with the topics that we will be discussing during today's broadcast, we encourage you to ask questions in the comments section of this video. We ask that you keep your questions and comments to today's topic. If we do not get to your question during the event, we will answer them as soon as possible in the comments. As a reminder, we cannot answer your questions about your treatment publicly. Please talk to your physician about these questions directly. Please note that the NCI reserves the right to not post comments and to remove comments that are inconsistent with our policy at our complete discretion. Additionally, if you have further questions, you can contact the National Cancer Institute's Cancer Information Service at 1-800-4-CANCER or by visiting cancer.gov/contact for live chat help. Okay, let's go ahead and get started. Our first topic that we will be discussing today is an overview of what exactly do we mean when we talk about psychosocial aspects of care for these children.
Thank you, Stephanie. The diagnosis of childhood cancer is a life-altering event for the child and for the family. And pediatric oncology treatment goes beyond the medicine and the care that is provided. One has to think about the whole child and the whole family. We think about the child's emotional well-being, psychological well-being, social well-being, spiritual well-being. So psychosocial care encompasses all of that care, and it's critically important throughout the course of the treatment and beyond that we consider that whole child and family and how they cope and how they adapt. And there's excellent data to be able to support each of those, make a difference in the outcome.
I think those points are exactly key of what the Children's Inn does. The Children's Inn, our mission and our goals encompass three overarching themes. First and foremost, we want to make that childhood possible. We want every child, no matter what their illness and their burden is, to be able to feel like a child again and have those experiences of participating in programs and activities here. Second, we want to reduce the burden and the illness on the family themselves. We want our caregivers to feel like they have support amongst staff, amongst each other, participating in experiences to bond with other caregivers, participate in respite events. And last but not least, we want to support the research of the NIH themselves. If children and young adults are willing to come here and are excited to come here, we hope that carries over for them being able to participate in treatment at the clinical center.
Yeah, that's truly psychosocial care. As you know, we often say there's no health without mental health.
Exactly.
And you do provide that.
Exactly.
I know that it's really important for the patients that we bring to the NIH. We ask the patients and the families to go through a lot of really difficult circumstances to participate in the clinical trials. And one of the things that's especially difficult is almost all of our patients are traveling far away from home. They're away from their normal support services. They're away from their normal family supports. And I think as the inn and the psychosocial support at the NIH is really important to allow families to be able to take that giant leap and move away from home to participate in clinical trials.
I think that brings up a good point of why the inn was created in the first place. Back in 1990, our doors first opened, and Dr. Lori Weiner can attest to this as she was one of our founders of the inn, so I'm happy to hear your thoughts as well. But essentially, Dr. Phil Pizzo saw parents staying in the hallways after a day full of treatment or sleeping in their cars, and that's not good support and good for their mental health, as you stated earlier. For their child going through treatment and for the caregivers themselves. So the Children's Inn was created to give them that place to stay. Of after a long day, they have a place to rest their head. And not only that, but they have food services, so that doesn't have to be a worry. They have support services. They have programs for children to just forget about their whole day at the clinical center and just feel like a kid again.
Yeah, that's very true. How often the children say, I have to go back to the children's inn, and they forget that they're coming up to go up for treatment. And it is because they have that to look forward to that they're much more adherent with their treatments. Absolutely. And they want to be able to come back, and more research could be done, and more cures could be found.
Absolutely. I tell the same story over and over, but I feel like there's so many kids that come here who are so excited to be at the children's inn, and mom and dad will come over to me and say, they didn't even remember that they're here for treatment. They just are so excited to be at the children's inn. So thank you for all you did to make the children's inn possible.
A lot of people involved.
Yeah. Beautiful. Go ahead to section 2.
Sure. Let's see if I can work the computer.
Okay, so topic number 2, let's focus more on services that we provide to support children with cancer. So what are those types of services and experiences do you use or we use to provide that support to children with cancer?
So psychosocial support includes many different interventions, again, as I said, from the time of diagnosis through the course of treatment and beyond. So it could be for a young child being able to understand what's happening, and for parents to need some guidance in how to disclose the diagnosis to their child and to the other family members. It could be for the very young child to be able to just process what's happening to their bodies, or to be able to help the parents to be able to parent their child who is now taking medicines that may make them feel sick and having procedures that could be very frightening. We use many different techniques. It could be for a young child, storytelling, therapeutic play, medical play for their preschool and the school-age child. You know, as they get older, we have behavioral interventions. Dr. Glad may refer a patient over to me because he needs them to be able to swallow a pill to participate in a clinical trial, or was too afraid to be able to get their blood drawn, so we're not able to start the medication. And we would use different techniques to be able to help them to be able to cope with that. It could be for the school-age child who wants to go back to school but is afraid because people will tease him or her because they don't have hair, or to deal with more body image issues, especially for the teenagers, from anything from hair loss, weight gain or loss, to amputation. And for adolescents, helping them really start to participate in decision-making and adherence to treatment, a sense of ownership. For those who survive, many other issues come up, to be able to get reintegrated and to be able to learn about self-care, transition to adult care. And for those who aren't going to survive, to be able to help them to be able to process that, to be able to do legacy work, to be remembered, to be able to communicate this with their families and help their families communicate with them, and to be able to help the whole family member through that process. So it's a process throughout the whole trajectory.
That's great.
I know when we have patients who come to the clinical center, we want them to be as comfortable as possible, and the inn and the psychosocial support service can really help with that. But it's also very important to have the child, no matter what their development and no matter what their age, to understand to the best of their ability what's going on, what sort of procedures they'll be subjected to, for the older kids, what is a clinical trial, and what are the ramifications of participating in a clinical trial. And we use some of these psychosocial support services to try to help with that, from Dr. Wiener's group to the school teacher to the child life services. They can incorporate play and school and other discussion with someone outside the immediate medical team into trying to understand what's going on.
So psychosocial care is integrated into every aspect of care. There's not medical care and then psychosocial care. It's all together. You can't think of a child just in terms of the medication that they need to take or a disease. You need to think of them in the context of their family, in the context of their emotional, psychological, social, and it said spiritual well-being.
Absolutely. The Children's Inn offers different types of programming. We have educational programming, recreational programming, and therapeutic.
Mm-hmm.
Falling in the therapeutic program is actually our most popular staff member, Zilly. She is our therapy dog. One of my favorite stories of Zilly, actually hearing both of your conversations of working with these patients. One of our patients had these very painful injections, and every time he had those painful injections, he asked that Zilly sit with him to support him and get him through those injections, and he did. And so their family grew to love Zilly and know what that support can make a difference for them. So they actually contacted Zilly's breeder, and they have their own Zilly now. The same name as Zilly. It's Zilly's cousin who lives back home. But these types of experiences and hearing these stories that are so powerful and make such an impact on a child's life is definitely important.
I hear that Zilly is very popular on Instagram.
Yes, Zilly does have an Instagram. Please follow her, Zilly the Therapy Dog.
Yeah, Zilly is great. The kids love Zilly. I have had on more than one occasion had to change the time of an appointment because the patient had an appointment with Zilly that conflicted, so we had to move some of their other appointments, but the kids love Zilly and talk about her all the time.
Absolutely. So let's talk a little bit more about referring a patient to the inn and how do they get there. I'm happy to talk about it myself, but if either of you have any experience on the clinical side of getting to the children's inn, I'd love to hear your input.
So I can talk a little bit about that. I would say most of our patients who are here for a repeat visit have already been to the NIH, know the children's inn, and will call the inn and set up their own visit to the inn even without us doing anything. I think, however, some of the kids who have never been to the NIH before don't know about the Children's Inn, and we can tell them about it and put them in contact with the Children's Inn. And this goes anywhere from really little kids, toddlers, all the way up to young adults. And I think the inn does a great job of accommodating and having activities for the littlest kids that we see up to kids that are making that sort of tricky transition from being a kid to a young adult.
So we actually house patients up to age 30. This number changed a couple years ago. It used to be age 26, but as you both are aware, working
30 is still a kid to us.
Well, working with...
I was pushing that one.
Yeah.
Increasing the
Perfect.
age.
Well, I'm sure you could attest to it, but for our young adults that are 26 to 30, if they have a rare disease or a critical illness and have gone through treatment their whole life, by the time they're creeping up on the age where they're not able to go to the inn anymore, they want that support, they need that support. So increasing our age, and I'm happy to hear your thoughts on it as well, allow them to have that extra support as well.
Oh, absolutely. The Children's Inn allows our patients and the family members to connect with other people who just get it. When they go back home, people don't understand at all what they've been through. And it's not that they're here and they need to talk about their medications and the name of their disease. It's just knowing they're amongst other people whose lives are similar to their own, that they can't guarantee tomorrow, that every day is just really precious. And we really try to collaborate as closely as we can to be able to provide the best medical care that we can to support them therapeutically through our psychosocial support and research program and clinical interventions at the hospital. But then they come down here where they could be able to balance their life and just to be able to relax in an environment that feels as much like home as possible. We really found through our research that the people who've done the best are those who they accept their illness and they could be able to talk with other people about what their illness is, but they also have a life outside of their illness. And so a lot of the work is also helping them integrate back at home, back into school, back into work, or back into their activities that they once enjoyed beforehand. And you help them with that as well. You have grants that be able to help individuals who may want to be able to learn a new skill or take a class when they wouldn't ordinarily be able to do so. So It's a really beautiful collaboration.
Absolutely, perfect. So when we get those first visits to the Children's Inn, they walk in. The first time I actually came to the Children's Inn, my supervisor described it as the Walt Disney World of Maryland, and it certainly feels like that here. And so when children come in for their first time, they get that sense as well. When they first walk in, we have lit up mailboxes for thoughtful treasures that every day they come back from the clinical center, they are able to go to those mailboxes and pick out their goodie that they get. And so it's exciting, just the short walk from Building 10, the clinical center, down to here. They have something to look forward to. We offer field trips throughout the week. Similarly, we want them to have experience to look forward to as well. So those experiences range from things that they might not even be able to get back home. So horseback riding, sailing trips, other therapeutic activities and opportunities like Viz Arts, which is creating glass pieces, colored art,
It's very popular.
Yes. Absolutely.
I think one of the events that the Children's Inn has collaborated with us on is there are times when we'll have a number of kids that all have the same diagnosis that will all be seen at the clinical center and at the same time. And one of the comments that we always get is the kids are really enjoy getting to have social time
Absolutely.
with other kids with similar issues and not just seeing them at the clinical center when they're getting their
Right.
CAT scan or something.
Yeah, and a population we really haven't talked about here is siblings. And it's so hard for the brothers and sisters who are back at home and don't really know what's going on here. And we know that a brother or sister who's really sick, it's pretty visible what's going on with them. But the pain that the sibling back at home may experience is invisible. So one of the programs that we collaborate with the Inn is Sibling Day. It's an all-day event where different members of the clinical center really open up their departments. For example, a laboratory of medicine. It's an entire room of labs, 5 different stations where they get to experiment under microscopes and be able to phlebotomy and to be able to learn about platelets and white counts and red blood cells with jelly beans and and then they get to a mock scanner, where they get to see what it's like to go through a scan and what that process is like could be for their brother or sister. And then when it's available, we even have an operating room where they can be able to scrub in and to be able to have the experience of what it's like to be, how frightening it may be, but to be able to see what takes place in an operating room. And then we come down here and we have activities. We have a cardiologist who does a really fun event over lunch, subs. We have therapeutic art, we have therapeutic music, we have therapeutic games. And at the end of the day, my favorite part is that they come in and there's a standing ovation for them from members of the healthcare team and from their families who surprise them to be there. And each person gets up, stands up, and gets an award for being a super sib. And the applause of being who they are, for being the sibling that is such an important part of the family is fabulous. My true favorite part is all you can eat ice cream that takes place at the event.
That's everybody's favorite. The Sibling Day seems to fall at the perfect time every single year. Every time we start advertising it to caregivers always say, oh, that's amazing. The focus is always so much on the patient, that this gives a focus on a sibling and allows them to truly understand what their sibling is going through. Okay. I'd love to hear more of what you all do in terms of your studies. So what studies are being done at NCI that are related to that psychosocial care, and how are their results helpful? How can they help us?
Well, thank you for asking about the research, because it's a beautiful marriage. We see the patients clinically and provide those services, and it's really what we learn from those clinical sessions and those clinical times about things that haven't been studied yet or new interventions that are needed. So for example, one of the studies is developing a screening tool. So important to screen for the psychosocial well-being of the child and family. The kids don't like to fill out a lot of forms, and neither do families, and so we have a new electronic screen. They said it's okay to check in with them, so it's called checking in. So we could figure out and know what kind of symptoms are really bothering them or interfering with their life. We also know for parents, if they're in a couple, a relationship, or a marriage, so much of the focus is really on the child and the medical care and what's happening maybe even at home, but rarely do we really investigate and ask them about what's happening to their relationship. So we have a study that's looking at the impact on a relationship and identifying the time points when a couple actually gets closer, but also the time points when they're most emotionally detached, which will lead into an intervention to help them to stay strong. We have a protocol that is looking at developing also a screening tool for the symptoms of children living with chronic graft versus host disease. Do a lot of work with sibling donors, and we're looking at the quality of life of those donors and how to best prepare them for the donation, as well as to be able to follow them after the donation and to improve their quality of life as well. And then there's an implementation of mindfulness-based interventions to help patients and families cope with the stress of their conditions. There's another protocol that's looking at the impact of exercise for children who've survived brain tumors to be able to improve their cognitive functions. And that's just a few of many of the studies that we have going on.
It's incredible.
I think Dr. Wiener's research has really been critical, and I think there's a couple of other things that I'd like to bring up. One is cancer research, I think, is evolving in a way where we don't only look at, what is how many centimeters big is the tumor, but we want to look at, are we really making any impact in the quality of life of the person being treated? And so patient-reported outcomes are now being incorporated into many of our studies, and that's been all of our studies.
Still working.
And that's a tremendous benefit to patients in helping us to understand not only are we impacting the cancer, but we really are treating the patient. So we are positively impacting the patient. I think that's been a great way of matching together basic science and psychosocial research. And the other thing I wanted to bring up is we do research on a very small number of patients here at the NIH, but really what we would like is for research done at the NIH to be used everywhere. And maybe you could talk a little bit about the guidelines for psychosocial care for patients with cancer that you were leading.
Absolutely. Just going to backtrack on one. So studies that Dr. Glad and I work on together, as he mentioned earlier, is on some really rare diseases. So part of the psychosocial portion of those protocols is for the first people to ever really describe what the disease is like to live with and their natural history studies. So we watch how this changes and the impact of the disease on them as they age, which is really important. So you talked about implementation, so I'd love to be able to talk about the standards. First, I'll just mention another study that we know from adolescents and young adults that they often really scared about what's going to happen and not knowing what the outcome of their disease. We often see people here on phase 1 treatment so that they may have, really seen many other treatments before and their prognosis is poor. And because we listen to their voice and about what's most concerning to them, they came up with the idea of having a document that was created for people their age. So a document created by and for people their age. We called an advanced care planning guide called Voicing My Choices. That's right now, there's been 53,000 copies distributed throughout the world, and it's in 4 languages. So yes, it's really important that we disseminate that. The standards of care really come from the brainchild of Victoria and Peter Brown, remarkable parents with their courage after the loss of their child, Maddie, to osteosarcoma, to realize that it's not just about the medicine. That's their logo, that we need to think about the psychosocial care of children and their family members. And so we had a big group of people, over 80 psychosocial providers from all over the country, including Europe, to be able to work closely to develop the first set of evidence-based standards. And there are 15 of those standards. And we're working really hard to be able to make sure they're implemented in all settings.
That's wonderful.
Yep.
Okay.
All right.
Okay, well, next we wanted to talk a little bit more about what we do here at the Children's Inn. We're actually lucky to have one of our resident parents here, Tracy, to help me talk a little bit more about that. Hi, Tracy.
Hey.
Tracy, do you want to introduce yourself?
I'm Tracy Rico. I have a daughter who is currently up at the NIH, just had a surgery, and is part of getting to be a part of this beautiful organization, the Children's Inn. And
Surgery
your
this
residents
morning.
here. A little emotional today. Sorry.
Well, thank you for being here and for willing to share your story and to
My
share
pleasure.
what the NIH has impacted you and your family. We appreciate that. So one of the big things that the Children's Inn does, and we touched on it a little bit earlier, is help families and children while they are away from home. So as you heard from Tracy, she's from California. So Tracy, can you talk a little bit about your experience when you came here and what was it like being away from home?
Our first experience was 6 weeks ago. My daughter and I came out here. Had the pleasure. You were a huge blessing to us. We came out. My daughter was possibly getting into a research study here, and she got really scared. She was ready to run and go home, and caused some tension between us. And the Children's Inn became that home away from home. Stephanie even stepped in and was very comforting to not only me but to my daughter. And we pushed through and we made it. But there were just little things that meant so much, and we met other families that we were able to talk to, and it really provided comfort. And even having a place to run away, they have these really cool chairs up there. And when Priya got really freaked out, she ran and just sat in those chairs and started spinning. It became like a child, and it really helped. Became our home away from home.
I think that speaks largely to what the Inn is all about. We offer, all those different programs and exciting things, but it also, really focuses on that comfort and that respite from exactly what you're mentioning of what you're going through. Part of my role, I was on family programming, so I got the fun of planning our monthly parties, but I transitioned to resident services, and resident services really focuses on building rapport with families like yours that, I think about each and every day and care so deeply about, and making sure that you have that support, that you don't feel alone. There's been so many times that we'll have children here. There's one that stands out in my head. She is always extremely happy, extremely smiley, and I talked to Mom one day. She was saying she's not really like that back home. So when she's here, Mom's like, everybody thinks she's always a super happy girl, but she's really not always like that. And I said, well, why is that? What makes it being here different? And she said, because she's not alone. She has all these friends that she can spend time with. Mom has other caregivers she can spend time with, and they don't feel like any different. They don't feel like they have to walk around with a face mask to hide their visible tumors. They feel like they can just be them and have friends here.
We've actually connected with one other family from when we were here 6 weeks ago, that has been just a comfort and an encouragement to us. And we met another family. We would love to reconnect with them that is actually from California, near where we are. And it happened sitting around the table eating dinner and just being normal. And it's a huge, huge thing when you're traveling from medical to...
I have to tell you, I used to run 3 support groups a week. And when the Children's Inn opened, people were like, we don't need this anymore. We sit and we meet each other and we talk just about everything the same we're talking about here at the Children's Inn, which was wonderful.
I think our services go beyond that. It helps, reducing the burden, which we talked about earlier. It helps financially as well. Coming across the country and, having to take days off work. Some people have to take months off of work and don't have that income. The Children's Inn offers breakfast, lunch, and dinner throughout the week. We offer grocery gift cards for families to go grocery shopping, especially when people have dietary restrictions. We want them to be able to pick out their own foods. We offer educational support if people need funding for an activity or programs. We have support that way. We are always open to hearing how we can support our families and make sure that this experience for them is as seamless and easy so they can prioritize spending time with their child or young adult who is here for treatment.
Something that we discovered on this trip that's been helpful is my daughter just first year college, and a huge stress for her is how do I balance my schooling? And she does not like to sit in a room and do her homework, and because she needs a little outside noise distraction. So the last 2 days she has sat up in the little bistro area, and has done her homework, and it feels like her college experience. So she's getting schooling done as well, which she wouldn't do that in a hotel because she'd be isolated in a little room. And that, I didn't think about that until she brought that up. She goes, Mom, I'm so glad I have this, or I wouldn't get any homework done at all. And that's important to have that. So little unexpected blessing of having a setting that welcomes that support.
Yeah, I think the family kind of atmosphere at the inn really, kids talk about that, parents just talk about that.
And food.
Okay.
And Georgetown cupcakes.
Yes, Georgetown cupcakes. Actually, that brings up a good point. Our most popular event is bingo. If you are ever here, I think it's the second and fourth Tuesday of every month we do a bingo. We have a wide range of activities, those recreational programs that I told you about, but even educational, bouncing off what you said. We know people are here for extended periods of time, and Priya just started college, and so she's able to do homework. And some people who are here who are missing school, we offer tutoring for them. We offer, if they don't speak English, we offer English lessons for them. We've recently started a STEAM program, so science, technology, education, or engineering, art, and technology. We want students and children to be able to feel like they can grow while they're here and have those hands-on experiences. Again, not to prioritize their time at the clinical center, but to be able to, feel like a child and grow here as well.
And we have a school at the clinical center for our patients, and unfortunately, the school can't teach the siblings, and the Children's Inn can, and that's such a gift for them and for their family members.
Okay, wonderful. Before we move on to our live questions, which please continue commenting below, we wanted to talk more with Dr. Glad. So this summer, we heard from the National Cancer Institute about the Childhood Cancer Data Initiative. So Dr. Glad, can you talk a little bit more about that?
Sure. So the Childhood Cancer Data Initiative is a program that will help to improve the treatment of children and young adults with cancer by allowing for data from different sources to be localized and used by different researchers. So there are lots of very talented people who are working on trying to improve the treatment of kids with cancer, and making a place where data generated by all of these different institutions and researchers is available for everyone to look at and to use is very important. I think this data initiative will be also very important for psychosocial data and allowing data from psychosocial research to be pooled and shared.
All right. We are now going to turn to some live questions from the viewers. Okay, so our first question, we mentioned that the Children's Inn goes up to age 30. So what's it like for older teens and young adults there? Tracy, if you want to add on to this, feel free to.
My daughter turns into a child coming back here. She's 18 and she gets giddy. She was giddy because I'm playing in the little chairs and stuff. And we went out and watched the mascots we got in on Tuesday and they had mascots. And so even though they're older, there's that comfort of being like a child. And even the mailbox, she got a little note in there yesterday and it made her day. Even though she's older, she's a young adult, there's still plenty. And I think it's important because it just, she's still my little girl and she got to be that. But one of the families we met, it's dad that's coming here for the treatment and they're staying here, and it's their daughter and wife is here as well. And so, it just the whole family thing. I don't think that there's plenty for, young adults and adults to do here. Even escape and get away, go have a cup of coffee or sit outside and just get fresh air.
Many of our young adults enjoy the young adult night out,
Yes.
which is no families with them. They just get to go out to a restaurant and it's just with other people their age. And I think it's 18 to 28 or 29.
Yeah, so our young adult night out, we have twice a month, and that ranges from different activities. We've gone to a paint and sip, fruit juice, of course, but bowling. We've gone to restaurants, especially with the nicer weather. They love being able to eat outside. It allows our young adults to be able to meet each other and connect. And although they're from all over the world with different diagnoses, they're able to connect with each other. With languages, exactly. They're able to connect with each other and feel like they're not as isolated and alone here. At the Children's Inn itself, we have a teen and young adult lounge, which is a huge hotspot for our teens and young adults that they're able to go in. We recently got a smart TV in there, so they're always watching their Netflix or Hulu on there. But it's just a nice getaway that they are able to have their own space.
Yeah, I think it's really important, even for people up to age of 30. If you think about when you start really establishing your life and your relationships, that happens in between the age of 18 and 30. And so if you have a serious illness, that really causes problems and causes more difficulties because you don't participate in the normal young adult activities. You're not getting your first job. You're not going away to school, some of our kids. And I think the ability for young adults with similar issues to be together and discuss things together really makes a huge impact.
Being alone in a hotel room when you're not feeling well is not hard, is hard.
Absolutely. All right, we'll move on to our next question. Are there any stories you can tell or tell us more about why you do what you do?
That's a hard one.
Can we talk about medical?
Yeah, I think it's hard to trace back to figure out why you do what you do. I think thinking about why I continue to do what I do as opposed to getting another job somewhere else is that I think there's a couple things that are really great about working with patients here at the NIH. I think patients and their families are so inspirational. Not only are they going through something very tough themselves, but you're being very philanthropic, and the things that you're doing are helping a lot of other people, and that's, I think, really important.
Something that Tracy and I connected on their first visit here. So I got into this field. I got diagnosed with a rare disease when I turned 21, and when I met Priya, I saw a lot of myself in her, and I think that's why I was kind of drawn to your family and to build that rapport with you all. Similarly, as I have mentioned so many times today, young adults and people with, cancer or other kind of illnesses feel isolated and alone. And at that age, as a young adult in my life, I didn't really know what to expect and what to do and who to talk to, which led me into this exact career path. Sorry to make you cry.
Tissues, somebody?
Sorry. And what you do is of huge importance because you connect with my daughter because of that. I think that's when she made the decision to go through with going forward with this. You sharing that. Sorry.
All right.
It's an honor, I could say it is such an honor to be side by side with families during some of the most difficult and challenging, frightening times of their life. And when people at home aren't going to be there to support you, but they don't get it. They don't understand what you're going through. They can't see what's happening on those floors. And to have somebody who could be there, and for me, just the honor of being able to be by somebody's side, whether it's for a new diagnosis or an end of life, or if it was to help because they don't have a meal that they just need to be able to find. Just being there for the good days, the bad days, and just taking that journey is a tremendous gift. So we thank you and families like yourself that allow us to be able to be part of your family, to be part of your lives, and hopefully to help you grow through this and beyond.
Wonderful. So we'll head into our next question. What are some myths that you think people believe about the psychosocial parts of cancer care? A good question.
That's a great question. Every cancer patient is depressed. That, they can't think of anything but the cancer. That mental health care is stigmatizing, is only for people who are crazy. Not recognizing that we all need support and help and guidance from people who've been there and done that and can help them grow. Other myths?
I would say from a standpoint of someone who's coming from a more of a hard science background, I don't think I realized quite the rigor of the science of psychosocial research until you showed me.
Good. That just made my day. I can retire now.
Great answers. Our next question, can you come internationally for a study at NCI or stay at the Children's Inn? So the Children's Inn has housed people from every single state and over 90 different countries. So the answer is yes, absolutely. And we love to support families from around the world to be able to provide them this groundbreaking treatment.
Yep. We have kids from all over the country, all over the world, and every one of them helps us to make treatment better for kids with cancer.
Absolutely.
We met a family yesterday, happened to be the same age as my daughter, and they sat and chatted a little bit, and she is from the other side of the world. It was pretty neat. They were doing comparisons and getting a little world education.
It's new words.
It's funny now, some of the patients that meet each other now, it's with the technology available, it's possible for patients to keep in contact with each other no matter how far away they live. So it's interesting, some of the relationships that develop.
And they're translators on their phones.
Yes.
Yeah.
Yes, which is so helpful. But we have a Facebook group for our children's and families, and people are posting in there all the time different stories and pictures of back home. We have international nights here where our families are able to make a meal and cuisine. Back home, one of our residents, she is from the Caribbean, so she made a home-cooked Caribbean meal, and she was just glowing. She was so excited to share that with everyone. All right. So our next question, I have more questions about the Children's Inn. What is the best way to get in contact? So if you visit childrensinn.org, there is a lot of information on there. You can also call us. Our number is 301-496-5672, and we would be happy to help you 24 hours a day. All right. I think that's all the time that we have for questions today. Is there anything anybody wants to mention before we sign off?
Thanks.
Thank you.
Thank you.
Thank you for listening and being here.
Absolutely.
Thank you for all that you do at the end.
Thank you for all you do. Okay, wonderful. So I'd like to remind all viewers that this video will appear both on the National Cancer Institute's Facebook page and NCI's YouTube channel. If there are any questions in the comments that we did not get to, please be assured that we will answer them shortly. To find out more about today's topic, please visit NCI's contact center at 1-800-4-CANCER or by email and live chat at cancer.gov. You can find other cancer clinical trials at trials.cancer.gov. Thank you all for tuning in to the latest social media event hosted by the National Cancer Institute. Thank you.
Thank you. Bye-bye.
U.S. Department of Health and Human Services, National Institutes of Health, National Cancer Institute, cancer.gov, 1-800-4-CANCER. Produced September 2019.